Day in and day out as a nurse, you courageously give of yourself, providing world-class nursing care to patients, and for that, we are all grateful. As nurses, there are countless demands placed upon you daily. Seemingly, the race to meet these demands starts the very minute you walk onto the unit or into the care area. However, it is critical that each caregiver has potentially life-saving medical information provided to them during patient handoff to ensure that they can provide safe patient care. My work here is done. I've done all I can do. It's time for the next caregiver to step in and continue the care of the patient. I need a tool to communicate effectively during this transition of care. Aha! There it is, the I PASS the BATON tool. It's just the tool I need to communicate important patient information to the next caregiver. So, I PASS the BATON works like a checklist. It ensures that caregivers convey the same information in a structured format every time. Now join us at the patient's bedside to see for yourself just how easy and effective the I PASS the BATON tool really is.
Lori, I'm getting ready to get off work, so I'm going to be gone. I'm going to turn you over to Tara. She's going to be your nurse for the day, but I'm going to give a real quick bedside report and make sure she knows what's going on so we can keep on track with the treatment we've started, okay?
Okay, thanks for including me. That helps me know what's going on.
So Tara, this is your patient, Lori Smith. She's a 60-year-old female with no known drug allergies. I assessed her, and overnight she's noted to be a little more confused. She had a low-grade fever, and her urine was noted to have a strong odor. It's a little bit dark and cloudy. The situation is she is a full code. She had a recent fall and an increase in confusion. We did treat her for the fever during my shift. It's improved. She's got a normal temperature now. The doctor's aware of everything, so new safety orders that were put in is a sitter. So someone will be back here, so she won't be by herself. Just make sure that someone's in here with her at all times. We did get a UA overnight, and the results were positive for nitrates. We got a CAT scan of her head. It was complete. Her background, she does not have a history of falls, but she does now have a new onset of confusion. So we're assuming that's the UTI, but we want to just double check. So stay on top of the CAT scan results. She has a history of hypertension and UTIs, and she is currently taking oral Bactrim for a UTI, but no family history really to give any indications of anything. So the actions that we have taken is she will have a sitter at bedside. The bed alarm is on. She knows not to try to get out of bed and to ask for assistance so she doesn't fall. Bed's in low position. She's got her grippy socks on. There's a sign outside the door. We did complete the post-fall huddle. Family was notified. Everything is taken care of regarding that. I did start neuro checks, and they've all been in normal limits. The timing that we did the CAT scan was right at that weird time when everybody changes shifts. So just make sure that you keep an eye out for the results for those. Lori has agreed to take ownership of her care. She's going to go ahead and use the call light if she needs to get up. She's not going to try to get up because we don't want her to fall again. And next thing to do is just continue with the neuro checks, stay on top of the CAT scan, antibiotics for UTI. I don't know if I told you, but I notified her family and they're on their way to the hospital now. So hopefully you guys will have a good day and you try to feel better.
Thank you.
You're welcome. Don't give Tara any trouble.
Okay, I'll try not.
Okay.
Well, Lori, I'm going to be back in a few minutes to take care of you and check on you. But if you need anything before then, just push your call light.
All right, thank you.
All right, thanks.
See, didn't I tell you? Look how smooth that patient handoff went. The I PASS the BATON tool is the best tool to ensure that pertinent information is not missed during the patient handoff process, and that the next nurse has all the information they need to safely care for the patient. When you are assuming the care of a patient, ask for the I PASS the BATON if it's not offered. By doing so, we can hold each other accountable to safe patient handoffs. Oh look, here comes a courageous caregiver now. I'm going to give her the I PASS the BATON so she has the information she needs to safely care for the patient.